Hello, this is Dr. Susan Sarajari from Dominion Fertility. Thank you for joining me here today. I wanted to just briefly talk about the saline sonohysterogram, also known as a saline infusion sonogram or simply as a water sonogram. And I want to just talk to you a little bit about what that really is and what it checks for. The saline sonohysterogram is a procedure that we do sometimes in the process of fertility evaluation and sometimes just before an embryo transfer or the cycle before an embryo transfer to evaluate the inside of the uterus to make sure there's no fibroids, polyps, adhesions, or any other pathology that can potentially prevent a pregnancy from implanting or cause a miscarriage. It is a procedure that's done in office, so no sedation is required, and after the procedure is done, you can just go home by yourself, so you don't need to bring another person with you to take you. And all it entails is simply placing a speculum into the vagina and placing a little catheter through the cervix into the uterus, which is also mostly painless. Most patients really don't feel that very much. And then injecting a little bit of sterile normal saline into the uterine cavity while doing a transvaginal ultrasound. And what the saline does is basically expands the uterine cavity, and so we can see in. And we can see, is there a polyp, is there a fibroid, is there an adhesion, is there an abnormality in the uterine shape. And so it gives us a lot of information. Like I said, the procedure is not really very painful. Sometimes patients have mild cramping when we inject the saline, but we ask them to take Motrin maybe an hour prior to the procedure. And also, otherwise, risks of infection are extremely low, usually less than 1%, but we do give you antibiotic prophylaxis just to decrease that risk even further. But like I said before, after the test is done, you might feel a little leaking from the saline that we injected, and sometimes you might have a little bit of spotting. Again, it gives us a lot of information about the inside of the uterus. It makes sure there is no pathology in the uterus that can prevent implantation or cause a miscarriage. And I would definitely recommend you have that done prior to an embryo transfer. Thank you for joining me here today. I'm Dr. Susan Sarajari from Dominion Fertility.
Dominion Fertility, making miracles happen, one family at a time.